/hello and welcome to Baby Care Tips UK, your trusted guide for navigating parenthood in the UK. Today, we're talking about something every new parent will face: umbilical cord care. It might look a little strange at first, but with the right knowledge, you'll handle it with confidence. Stick around as we go through the essential do's and don'ts to keep your baby safe and comfortable during this delicate stage. Part 1. Understanding the umbilical cord stump. When your baby is born, the midwife will clamp and cut the umbilical cord, leaving behind a small stump. This stump usually dries out and falls off naturally within 1 to 2 weeks. During this time, it's important to keep the area clean, dry, and free from infection. Let's break down exactly what you should and shouldn't do. Part 2. Do's for cord care. White tick mark emoji. Do keep the cord stump dry. Dryness helps the stump fall off naturally. After changing a nappy, fold the top down to allow airflow and prevent irritation. White tick mark emoji. Do give sponge baths only. Avoid soaking your baby in a bath until the cord stump falls off. Use a warm, damp cloth to gently clean around it. White tick mark emoji. Do use clean hands. Always wash your hands before touching the stump. It's a sensitive area and can easily get infected. White tick mark emoji. Do dress your baby in loose-fitting clothes. Tight clothing can rub against the stump. Opt for soft cotton clothing that allows for airflow. White tick mark emoji. Do watch for signs of infection. If you notice redness, swelling, pus, a foul smell, or your baby seems unusually fussy, speak to your midwife, health visitor or GP. Part 3. Don'ts for cord care. Cross mark emoji. Don't pull on the stump even if it looks like it's hanging by a thread. Never pull it off. Let it fall off naturally. Cross mark emoji. Don't cover it with tight nappies or plastic pants. Covering the stump with damp or airtight materials can trap moisture and increase infection risk. Cross mark emoji. Don't apply powders, lotions, or alcohol. These can delay healing and may cause irritation. NHS guidelines recommend leaving it alone unless advised otherwise by a healthcare professional. Cross mark emoji. Don't worry if there's a small amount of blood when it falls off. That's normal. However, if bleeding continues or gets worse, seek medical advice. Part 4. When to seek help. You should contact your midwife, health visitor, or GP if the stump hasn't fallen off after 3 weeks. You see yellow pus, foul odor, or redness spreading. Your baby develops a fever or seems unwell. It's always better to check than to wait. Closing. Taking care of your baby's umbilical cord stump might seem a little intimidating at first, but it's usually a straightforward process. With clean hands, gentle care, and a watchful eye, your baby's belly button will heal beautifully. Speech bubble emoji. Let us know in the comments if you have any questions, or share your experience as a new parent. And don't forget to like, subscribe, and hit the bell icon for more trusted UK-based baby care tips. Thanks for watching Baby Care Tips UK, helping you care with confidence.